Hey guys, in case you're wondering how you should treat a patient who's immunocompromised and has contagious diagnoses. In this video, I'm going to explain to you how you should treat a patient who's been diagnosed with HIV, tuberculosis, hepatitis, and other contagious diagnoses and infections. Well, the best way I've found throughout the years that you should treat a person who's suffering from HIV, hepatitis, tuberculosis is basically take the body substance isolation precautions. Like you have gowns, you have face masks, you have eye shields, you have gloves. Like if I'm just gonna say hello to the person, shake their hands, I don't need to wear gloves. But if I'm gonna go ahead and start an IV or intubate this person, then I want to go ahead and take the precautions necessary. The best way to treat a person who's suffering from an infectious disease that requires immediate attention, like for example an IV fluids for dehydration, sedation for intubation. I'm sorry about the noise, I'm at the gym, so I just got out of work and I'm about to get my workout in before I go home. The basic way that I found to treat a patient who has an infectious disease is basically treat them like any other patient. You know what I mean? So if you have a person with HIV or hepatitis whose blood pressure is 70 over PALP, start the IV on them too. That doesn't, just because they have that disease doesn't mean that you shouldn't treat them. Treat them just as you would any other patient is basically what I would say. That's the way you should treat them. But at the same time, take body substance isolation. So instead of wearing one glove, you could wear two gloves. I'll tell you one story. One patient during OBGYN rotation while I was in medical school had hepatitis. Unfortunately, the resident didn't have the face shield. She wasn't able to control the bleeding while delivering a baby, and blood squirted in her face, and she had to stay on antiviral medications that messed up her whole homeostasis for weeks. She was miserable. And that could have been avoided if she wore the face shield and the mask. So, just don't let that be you. It happens at times. There's exposure that's inevitable, but, the more you prevent it, the better. In general, treat the patients the way you would treat any other patient. Respect the patient's autonomy, respect their feelings. Like I remember one time I had a patient who had HIV and he was really upset, but I treated him like a human being. I treated him like a person. And when we dropped him off at the hospital, he was like, hey man, you should be very happy that you're a nice guy, because my plan was to bite you and your partner. I wanted to share my infection. But since you guys are so cool, I decided not to do it. And that's a real story. So, just treat the patients as you would any other patient, and you should be fine. But at the same time, like I said before, and I'll say it again, just take the proper body substance isolation precautions depending on every patient. All right, I hope this helped. Please share it with someone who you think might need it. Please give it a like, subscribe to my channel. I have videos coming in every week, and I hope this helps some way, somehow. Remember, the best knowledge is the one you share with someone. Pay it forward. All right, peace.